King.
And I'm Chris Gandhi.
Tonight on our Livetalk Diaspora Forum, we are looking at the COVID-19 cases in the country and the world. As yesterday, which was February 2nd, Zimbabwe had recorded 33,814 cases with 1,254 deaths and 460, that's 4,160 PCR tests done yesterday. And as of yesterday, new cases recorded, the new cases that were recorded were 266 cases and 20 deaths. And we have seen a trend that the figures are going down in the country, Chris.
Yes, Jonga, and of all those that passed away as of yesterday, 11 were from Harare, 2 from Bulawayo, and several other regions as well got fewer figures. Like Jonga is saying, the figures seem to be going down.
And remember that of the 266 cases recorded yesterday, they are all local cases, and Harare had the highest of 107 new cases. And as of yesterday, 2nd February, Zimbabwe had recorded 26,794 recoveries, which is a good sign. And we are also looking at the vaccine, because Zimbabwe is of yesterday, we had that China had pledged to help Zimbabwe get vaccines. And then South Africa received its first consignment on Monday. And here in the diaspora, many Zimbabweans out here have so far gotten their dose or first dose or doses. Look at all that. And as of now, we are joined by our colleagues here in the diaspora. We have Dr. Simbiso Ranga, Mr. Siposenkosi is Mashanzi, and they will be joining us as soon as totanga tambo kurukura nerurimi rwamai kuti chii chatiri kukurukura nezvacho nhasi uno. Tiri kutarisa nyaya yedenda reCovid-19 muZimbabwe. Tinoona kuti kusvika pazuva ranezuro musi wa2 kukadzi kana kuti 2 February, vanhu vanokwana kuita 266 vakabatwa nechirwere ichi, atingati new cases, kuchiita vanhu vanokwana kuita 20 kana kuti 20 vakafa nezuro. Uwandu hwevanhu vatsva vakabatwa nechirwere ichi wakakwidza vanhu vabatwa nechirwere munyika yose kubva pachatanga kusvika pa33,814, kuchitiwo vanhu vafa kusvika pari nhasi vanga vasvika pa1,254 deaths. Asi hatikanganwo vapora kubva kuchirwere ichochi. Kubva pachatanga tinoona kuti vasvika pa26,794. Iye zvino izvi mazuva ano tiri kuona kuti vebazi rezveutano pavanozivisa nezvemamiriro akaita zvinhu, vari kubva vataurawo nemamiriro anenge akaita uwandu hwevanhu vanenge vachiri muzvipatara, vangadai vachiri kurwara nevanenge vakunzwa zviri nani, vanenge varimo. Tiri kuona vari kuti ivo kusvika nezuro pakanga paine kana kuti musi wa1 musi weMonday paine vanhu vaikwana kuita 148 vanga vachiri muchipatara nekuda kweCovid. Pavani iwavo vaiti 79 vanga vaina vangadzi pachirungu mild to moderate kana kuti vainzwa zviri nani, koita 59 vari kurwarisa, kozoita 10 kana kuti 10 vanga vari muintensive care unit. Asi vari kuti zvipatara zvinoti Mater Dei neThorn Grove hazvina kunge zvazopawo mamiriro akaita zvinhu panyaya idzodzo, Chris.
Yebo, ngambe Zulu kaNdaba siyadibana njalo kuhlelo lwethu Livetalk Diaspora Forum. Namhlanje ke siqhubeka ngodaba lokukhangela igciwane le-coronavirus lona eselithethe imphefumulo eminingi kakhulu emhlabeni jikelele. eZimbabwe sebefika bona 1,254 asebebulewe ligciwane le-COVID-19, umkhuhlane we-COVID-19. Abalawo sikhuluma nje abaligciwane leli bayedlula bona 26,794. Sikhuluma nje sabona ukuthi amanani angani hayi ayehla sibili asazi ke silabo dokotela lapha silengcwethi ezizasincedisa ukuthi sikhangele sihlaziye ukubana kuyini kahle kahle okwenzakalayo liyehla kakhulu yini igciwane leli emhlabeni jikelele ngenxa yejekiseni le isikhona kumbe hayi bekulikhefu nje lekhisimusi njengokutshiwo ngabanye ukuthi ngekhefu lekhisimusi yikho lapho kwenza ukuthi inani labantu abaningi batholakale belegciwane leli kodwa ke hayi isikhona kumbe hayi ezandleni zabaziyo ke ingcwethi jonga
Chris ndokusiya uchitanga kumboisa mubvunzo kune vadare vedu vatina vekutanga vatina Dr. Simbiso Ranga vari muno muAmerica na mukoma Siposenkosi ndokusiya Chris uchimbotanga kubvunza iwe.
Yes jonga I will start with Mr. Balule from the UK, from the United Kingdom, Mr. Siposenkosi Machokomola Balule. Yes, can you tell us the situation? What's the situation in the United Kingdom?
The situation in the United Kingdom is progressing very well in terms of vaccinations. So far, the United Kingdom has managed successfully to roll out the vaccination program and reached about 9 to 10 million people in the UK, which is a record number. But we still see that there are some parts of the UK, like Scotland and some parts of Northern Ireland, that are lagging behind the vaccination program, which is being rolled out throughout the entire country. But in Europe, the UK is leading in terms of the vaccinations, and they acting very fast and very efficiently, and that is actually being welcomed by many people in this country because it is a relief to many people, especially the elderly and those who have underlying illnesses. So it is actually a program that is going well in the UK, despite it having had some teething problems. But overall, the program has been rolled out efficiently.
Thank you so much. Dr. Ranga, ndotanga hangu nerurimi rwaamai kuti mumbotiudzawo kuti nyaya yekuwanikwa kwenhomba kana kuti yekupiwa kwenhomba iri kufambawo sei tichitarisa muno muAmerica mamuri. Tinotarisira kuti imi makatowana nhomba iyoyi sezvo dzichipiwa dziri mbiri, dzimwe nguva makatodai mawana dzese dziri mbiri, mungotidzawo zvakamira sei?
Hello Mr. Kandemire. Chandingataura ndechekuti muno muAmerica rollout yenhomba kana vaccination iri kufamba, but chandingataura ndechekuti it has kind of had a slow start because coordination yanga isiri centralized at the beginning. Saka ma-states anga ari kumanager the vaccination process. Saka ari pama levels akati siyanei. Of course, priority iri kupiwa kuma healthcare workers like myself. Saka inini ndakatowana ma injection ese ari 2 Pfizer vaccine. The last one I got on the 14th of January. Saka as it is, I mean, I'm not as much concerned now. Of course, I still practice social distancing, face masking, and the like until and wakawanda vawana nomba. Asi ndinoona ma states like North Carolina parikitwa ma rollout ema public vaccination campaigns like per weekend panapa kune kunonzi ku Bank of America Stadium kwe football. I think we can vaccinate about 16,000 people per weekend, Saturday, Sunday. And more campaigns like that are coming down the pipeline. Also, Vaka distributor my vaccines, the federal government, Yaga distributor nomba kuma pharmacies, Varikuita partner, Nana Walgreens, CVS, and so forth, so that it will be more readily available. Shangata ora ndechekuti vaya vakwegura are above 65 and the like, nema essential workers, my healthcare workers ndo vakatanga kuwa na vaccine. Uyezve, I think they need to make it easier for the elderly kuti vasaita ma-registration ari kuitwa online. It may be time consuming for the elderly. Saka, I think with time we're gonna see things move much faster because the Biden administration is kind of hands-on, working with my states and local authorities. And as more vaccines become available now, Tavane Pfizer, Tavane Moderna, Tavane Johnson and Johnson, it's almost it's at yet emergency use authorization, but we expect that to happen anytime from now.
Thank you so much, Dr. Ranga. Maybe you can just explain 30 seconds in English the same.
Sure. What I can say is vaccination is going on pretty decently here in America. Healthcare workers like myself were the first ones to get vaccinated. I already got my 2 shots of the Pfizer vaccine, and elderly people 65 and over across the country are also getting vaccinated. It's kind of a slow start because of coordination, logistics, and so forth, since the previous administration wasn't hands-on in terms of the logistics, but the Biden administration is taking a much more centralized approach to coordinate with states and local authorities. So we expect things to move faster. Just recently, they announced that some vaccines will be sent to pharmacies like Walgreens and so forth, so that people can just go there and get vaccinated instead of going to a private office or a hospital. Thank you.
Thank you so much, Dr. Ranga. Chris.
Yes, Mnumzana Palule, ungasitshela wena ngamafitshane ukuthi umumo unjani khona ngapha kwele Bhilitane?
Umumo ngapha kwele Bhilitane ngokuhlatshwa kwabantu ngama injection lawa awe COVID anqabela umkhuhlane we COVID uhamba kakuhle. Uhulumende walapha uphakamele phezulu, wasukumela phezulu, wakhankasa, awahlanganisa abantu kuleli lizwe behlatshwa ama injection lawo. Sebehlabe abantu abafika i9 million kuloke kuqansa nje ngelanga. Ngasikhangele iEurope yonke, iBritain isihlabe abantu abanengi nxa siqathanisa lamanye amazwe eEurope. Kodwa ke eBritain lakho lapha kunjalo, kulamanye ezinye izigaba zeBritain ezinjenge Scotland le Northern Ireland zisasalele ngemuva. Uhlelo lolo lokuhlaba abantu luqale ngabantu aba over 65 kusiya phezulu, labantu abasebenza kweze healthcare abafanana lathi. Lami sengiyitholile injection, ngithole iPfizer, ngithole eyakuqala, ngathole esibili. Abanye lapha bathola injection eye Oxford AstraZeneca, sebeyitholile layo ikhona, abantu bayithola. Njalo uhulumende ukwenza kube lula ukuncediswa la ngamasotsha, amasotsha akhona lawa ayancedisa kodwa ukuthi eqoqe nje abantu, ehlela abantu ukuthi izinto zihambe zonke ngohlelo oluqondileyo. Izibhedlela eziningi zivele sezilezi ndawo okuvele kufakwe khona ukuthi abantu bebuye bezohlaba ama-injection abo. So luhamba kakuhle uhlelo lolu, njalo sikhangelele ukuthi laba injections zesibili sebeqalisa ukuthi bezihlabe abantu injections zesibili. Kodwa ke iBritain yona uhlelo lwayo ukwehlukanisa injection yakuqala leyesibili bayachiyanisa sibili isikhathi, kwesikhathi uyachiyanisa inyanga zingaba 3 kumbe kube ngamaviki angaba 6. Kwehlukene le-America, mbona athi i-America basakhuluma ngakho ukuthi la bebona ukuthi bebengayehlukanisa yini injection yakuqala leyesibili. Kodwa lokhu iBritain yakuthatha njengesinyathelo sokuthi ikwenze kube njalo. Bayenze ke ubungcwethi bokuhlolisisa ukuthi lokhu kuyayenza yini ukuthi kwenqabele umkhuhlane. Ngakho lamhlanje sithole impumela yalowo bungcwethi be-research leyo evelela e-Oxford AstraZeneca ethe yebo, ukwehlukanisa ngesikhathi lesi i-research ithi abantu babevikelwe ngaseneso sikhathi angeke bewuthole umkhuhlane okungayenza ukuthi begule kakhulu ngaseneso sikhathi ngoba injection yokuqala iqhakathekile njalo iyavikela umkhuhlane.
Dr. Ranga, we understand there are some people who are not taking the vaccine. Are the figures who are not taking the vaccine because they are skeptical about them? Is the figures high, or it's just a very few people?
Thank you, Chris. I think that as more people are getting vaccinated, the skepticism seems to be waning down. I'm talking in terms of the hospitals. I mean, because I interact with nurses, doctors across several hospitals here in the Charlotte area. At the very beginning, there was much more skepticism. A lot of people just wanted to understand more what's happening. But as more and more people are getting vaccinated, I think now we are close to 30 million, vaccines given so far in America. I am seeing that at least in the hospital community, people are following each other and they're seeing if nurses have been vaccinated, fellow nurses are following suit. Most doctors are getting vaccinated. I think that as people realize that it's safe, the vaccines are safe, and they watch their relatives, their co-workers, other professionals getting vaccinated, more and more people are going to get vaccinated. So I hope that trend continues. What we have also seen, there was a report today that said 70% of the people vaccinated so far are Caucasians, and anyway, 20 to 30% minorities, including blacks. So there's still more skepticism in the minority communities as expected, but that should improve.
Mr. Balule, what about in the UK? Are you having people saying that they are not going to take the vaccine, come what may?
Yes, there are groups of people who are saying that they will not take the vaccine. People have different views. Some is religious views, and some is a mere skepticism about whether they should take the vaccine or not. We have seen it's more within the ethnic minority groups, blacks, Asians, and the other ethnic migrants. They don't trust the efficacy of the vaccine. They don't trust the government. That relationship between the government and ethnic minorities is very crucial in the execution of a successful program like this one. However, some ethnic minorities think that some of these programs may be targeting them in some way. This is because of the conspiracy theories that are being really, banded around by lots of group of people with the different agendas. So some people, without paying any attention to research, science, and facts, they do fall into those kind of conspiracies. I think what is required is the government to roll out some awareness campaigns and some facts about these vaccines, how safe they are, and seeing high-profile people as well accepting these vaccines, especially from the ethnic minority groups, will be crucial to raise awareness among some ethnic minority groups. I've also seen that although the program is not yet open to younger people, but already there is a simmering sort of like skepticism within young people. I don't think that they will take the vaccine, the majority of them, because they are actually against these vaccines for some reasons, and some of these reasons are based on conspiracy theories.
Dr. Ranga, tinonzwa vanhu vakawanda vanotya kubaiwa nhomba iyoyi zvikuru yecovid. Vamwe vari kutaurawo mashoko akasiyana siyana ari kubuda pamusoro penhomba iyoyi. Zvii zvamungataura tichitarisa kuti nzira yekuti vanhu vakwanise kunge vachibaiwa nhomba kunge zvichitaurwa nezvazvo, asi kune vamwe vanoti aiwa makataura nezvazvo muri kuita kunge muri kukurudzira vanhu kuti vabaiwe, maakuita kunge muri kutomanikidza vanhu kuti endai munobaiwa. Zvii zvamungataura panyaya iyo?
Chandingataura Mr. Kandimire ndechekuti nhomba tagara tinobaiwa the world over. Zimbabwe, America, you name it, everybody. Tese zvatiri panapa, I think everybody akabaiwa nhomba, measles, mumps, rubella, vamwe tinobaiwa flu vaccine every season, winter season. Saka chandingataura ndechekuti of course ma-conspiracy theories akawanda ari kuita kuti vanhu vave nedistrust kana kuti vasatenderana nenyaya yekubaiwa nhomba, and zvimwe zviri kuitiswa nevanoparidza shoko, mapoliticians. However, chandingakurudzira veruzhinji ndechekuti for most diseases, kana zvirwere zvatingava nacho ishuga, high blood pressure here, hypertension, hatiende kumapasta kana kumapoliticians, tinoenda kumachiremba kunovhunza kuti ndarwara, what kind of medications should I take. Saka chandingakurudzira veruzhinji ndechekuti take your example from vanhu vari muhealth sector. Of course there are some in the health sector vari kuitawo propel some of these conspiracy theories, but vazhinji vanonzwisisa, vanoverenga mapepa escience kuti research yacho yakafamba sei, tasvika sei patiri, including myself. Hatitomborina any reason to be skeptical. But like any new medications, kune ma-side effects, mamwe atinoziva, mamwe achazouya down the line. But tichitarisa kuuraya kuri kuita chirwere ichi vanhu, right now tinonzwa kuti kune machiremba akati wandei kuZimbabwe, pamwe autosvika 10 maybe, mamwe maprofessor vashaya in the past couple of weeks nenyaya yechirwere. So we really don't have another option other than vaccination. Of course, until we get vaccinated, tinofana kuramba tichipractice social distancing and so forth, those measures no minimize the spread COVID. Ndo zvandingataura Mr. Kandimire.
Ipapo ndisanda kupai kune mumwe wangu kuna Chris Gande. Pane nyaya yekuti vamwe vanoti toti munharaunda mune vanhu 100, vanoti kwakabaiwa kana vanhu 50 kana 60, vamwe 40 vakasabaiwa. Kubaiwa kwaita vamwe ava kune yavanoti head immune, hanzi zvinoyamura izvozvo kana vamwe vakasazobaiwa asi vamwe vabaiwa. Mungatsanangura zvinofamba sei ipapo?
Chandingataura ndechekuti Vakandimire, goal kana kuti chatiri kutarisira pasi rese ndechekuti tiachieve iyo yatinoti herd immunity. Herd immunity kushanda kwainoita ndekwekuti kana vanhu vakawanda vari immune, whether vaita immune through kuwana chirwere temporarily kana kuti vawana nhomba, it means that chirwere pachinenge chiri paya chinoshaya vanhu vekubatira. Saka as more and more people get vaccinated kana vanhu vachibaiwa nhomba, it means that chirwere chinenge chisisina kwekuenda and chinenge chisingachakwanise kupararira. Saka it means fewer people. However, I hope vanhu are not saying, well, inini ndikasabaiwa anyway, most people are gonna get vaccinated because you are still prone to get the disease if you are not immunized. So what I would encourage munhu wese ndekuti the sooner we all get vaccinated kana vaccine yava available, the better it will be for us, not just in terms of immunity but in terms of being able to function sema-societies. Because tiri kuona ma-lockdown nezvakawanda zviri kuenda back and forth. Kusvika tasvika nhamba yakakwana yevanhu vabaiwa nhomba, tinenge tiri padambudziko chairo.
Thank you so much, Chris.
Yes, Mr. Balule, we have heard some people saying that they've been able to take care of themselves after being affected by coronavirus using you know, lemons and other stuff. Have you heard that, and how effective have you heard that it does?
Sorry.
I have heard that people are using all sorts of therapies, all sorts of treatment. In terms of effectiveness, I'm not sure really. What I know is that I understand the World Health Organization is actually looking into some of these therapies, especially coming from Africa and other countries, studying those. But yes, people at home, they do all sorts of therapies like that, steaming and using lemons and all concoctions. But what really, as healthcare professionals, advise is that you need really to be tested, and you need to seek medical treatment from well-established medical practitioners, because this disease is dangerous, and this disease has a high number of fatalities really in many countries. And for many people really to try at home, it's an individual choice to start with. But some of these therapies, to some people, they say that they work for them. To some people, they do not work, and people end up seeking medical help when it's too late. So people have to balance that really and trust science. I would really suggest that we have to trust science. We trust the tested facts of science, and we follow the advice from the scientific community when it comes to treatment. And for those who want to make whatever concoctions that they wish to, they have really to really be very, very careful. I wouldn't sit here and judge people in terms of what they do in their own homes as individuals. But what I would say as a healthcare professional is that you need to seek medical advice and follow medical advice.
Oh, okay. So, Dr. Ranga, what's your take on these remedies, on these home-based remedies?
Yeah, Chris, what I can say is what my brother just said there is on point. Things like these steaming, zumbani, other things that people are doing at home. What Zimbabweans should remember is that these remedies have been in use for centuries before we knew there was COVID-19. So there are things that have been tried for so many things. You have a fever, somebody tries zumbani, tries steaming, the lemons and things like that. What we know is that, like my brother was saying, people delay care when they try to manage these things by themselves. So the starting point should always be seeking medical help early. See a healthcare professional if you're sick. And then, you know, they will give you advice as to what kind of treatments you need and what kind of testing you need so that you don't delay care. You can always try this. I don't have enough information about research surrounding some of these home remedies. So I'm not here to say don't use them, but I'm saying use them, but start with the doctors. Start with the, you know, your primary care providers and so forth, so that they make a clear diagnosis early, so that you don't delay care if you need care. Because we've had so many stories of people saying, "Oh, he just died suddenly last night." I think the more correct statement is to say, "Well, he has been sick for 2 weeks, toughing it out, trying different things, and everybody else got to know about it when it was too late." And we don't want that to happen with COVID-19.
Mm.
Yeah. Okay. John.
Thank you so much. Mr. Balule, we've noticed that in Zimbabwe, the figures were high and now they are going down. What can be explained as the best remedy that has produced these results?
Yes, we have had a lot of figures being banded around in Zimbabwe and elsewhere in other countries. But in Zimbabwe, we also have, to think about whether there's enough testing really, going around, people being tested, or they have reduced the testing. We don't know. But if indeed it is indicating that the figures are going down, that may be suggesting that they are past the peak, if ever they have reached the peak yet. That could be a result of the measures that the government took, like the lockdowns, and being strict with the application of the law in terms of the gatherings. We have seen people being arrested for public gatherings and stuff like that. And also the public awareness, because we have high profile figures in politics and in other sectors in Zimbabwe who have succumbed to COVID-19. That may have actually raised awareness and frightened a lot of people. And the result of that, people taking a lot of measures in terms of mass and social distance. So actually went in some way.
Yeah, I think he is having a bad connection there. But timbonzwa kuna Dr. Ranga. Munoti Dr. Ranga tiri kuona kuti kuZimbabwe uwando hwevanhu vari kubatwa neCovid-19 huri kumbokwira hodzika, hokwira hodzika. Tingati here pane danho raita kuti zviitike kana kuti kugona kwaitwa nehurumende kudzikisa uwandu?
Chandingataura Mr. Kandimira ndechekuti tichiona manhamba achiderera zviri encouraging, zvinhu zvinofadza. I see, like Mr. Balule was saying, I think my numbers are very understated for many reasons. So we have to take the numbers with a grain of salt. Asi chandingataura ndechekuti kuti dambudziko reCovid-19 ripere, the crisis iri muZimbabwe, it's a coordinated effort. The government, of course, in a role player, some things that they have recommended, like lockdown, some decisions about my funerals, things like that have helped, and enforcing the law. I am more for that. The citizens are doing a great job. Everyone, and the citizens include the citizens' government, right? So my citizens pachao, a lot of Zimbabweans are toughing it out from Avaskwana chikafu for a while, because they can't go out there and they don't have the money to spend. So my measures, when we follow them, including my social distancing, face mask, to avoid my crowds, when we do those things, it works. And we know that my numbers are kwira because around Christmas, New Year, when we had my celebrations, they came together. South Africa, those were some of the reasons. With my numbers, all of a sudden go up, and people relax, thinking the disease is under control. That's why more testing is essential. So it's encouraging, but we're not out of the woods yet, because when I was at vaccination with Zimbabwe. So as long as that's true, the disease can still spread. My super spreader events, like now, if people open up, my churches, they open up, my family gatherings, my schools and stuff, without adequate measures in place, we will end up here again. So what I would encourage, it's encouraging, but we need to double down until at least enough people get vaccinated.
Thank you so much, Dr. Ranga. Ameno kuti muchine mukanero kuti tirambe tiine mitombo kusungai kana kuti maakuda kuoneka.
Maybe another 5 minutes.
Thank you so much, Chris.
Yeah, let's take advantage while you are here. Can you tell us about this variant these new variants, because we hear they keep mutating. Now there's another variant and so forth. Can you tell us what's really going on, and is this unusual or what?
What I would say, Chris, is that with any virus or other infections, bacteria, fungus, and the like, they can do what's called mutation, which is where they change their form or shape so that they can avoid treatments and they can last longer. So what's happening is we have a number of variants because we have been with COVID since uh, January, February 2020, and it has been spreading all over the world. So mutations have happened, and we have picked up mutations in South Africa, in the United Kingdom, in Brazil, and I'm sure there are other countries where there are mutations. What that means is that the vaccines that have been developed, some of them may still be effective against most of the variants, but some of the vaccines may need to be tweaked, particularly to accommodate the South African variant. That's what I'm hearing from researchers. So unfortunately, it's likely that the South African variant is in Zimbabwe. I would not see a scenario where that's not true. But obviously, we don't have enough information. I think the last time, sometime last week, the government was saying they're still doing genetic sequencing and they like to understand, if we have the South African variant in the country. So that will also inform as to what vaccines are most appropriate for Zimbabwe. And the main thing I would still say is preventing spread is one of the biggest tools that we have, and that's through this social distancing and so forth, and also vaccination.
Yeah,
Thank you so much.
Just one more question, Jonga,
Sure.
to understand these mutations. Why is it we are hearing more of the mutations of this particular virus, the coronavirus? We've had viruses like the HIV or even the common flu. We never hear of them mutating. Why exactly are we not hearing about them?
Sure, Chris, that's a good question. Well, we're not hearing about the others like for HIV, the flu, because we don't talk about them a lot.
But
The reason why we get vaccinated every year for the flu vaccine is for that very reason. Because they shift, the viruses shift over time, and pharmaceutical companies adapt every year. That's why we need boosters every year for the flu. And the same is true for HIV, any other viruses which we haven't talked a lot about. So COVID-19 is nothing different. It's the same concept, obviously. It has spread much faster as a pandemic across the world. So we're going to see more mutations. That's the answer I would give you. It's happening with other viruses. We just don't hear enough about them.
Oh, okay.
Alright,
Thank you so much.
musati maenda Dr. Ranga, vakawanda vari kubvunza kuti sei iyo variant itsva iyi kana kuti utachiwana hutsva ihwohwu huri kudaidzwa nezita rekunzi South African variant. Hanzi hakusi kushoropodzawo here nyika yeAfrica ikoko, nokuti kana chiri chirwere chinofanira kunge chine zita racho.
Oh my goodness. Well, COVID-19, I mean, I know that debate went on, Mr. Kanimi. It's a very good question. It went on, we called COVID-19 the Chinese virus, we called it the Wuhan virus, and so forth. But there is a distinction. I don't think it should be viewed in derogatory terms. There is a name for the South African variant, 315 something, but most of us would not remember that. So it's much easier to call it the South African variant, the UK variant, the Brazilian variant. I don't hear a lot of people saying, well, you're looking down on the British people when you call it the Brazilian variant or the British variant or the Brazilian variant. I think that if we're thinking of it in terms of geopolitical lens, that's very unfortunate because everything, even travel bans and so forth, some people are tending to look at it in terms of, well, it's from Africa, that's why they're banning us. The correct way to look at it, at least from a medical perspective, is that when you have a pandemic or an epidemic, you have to figure out what is the virus or the bacteria, where is it originating from, and what you want to do is you fence off that area while you treat those who are afflicted. And
Just
that
one final one, Dr. Ranga.
Sure.
You know, when we talk about geographical names, I remember the first time when coronavirus broke out in China. I think it was the United Nations, the World Health Organization, issued some statement to say that viruses should not be named by region. That was after some people had asked that, for example, with the virus in Congo, what did they call that? The
Ebola.
Yeah, the Ebola was named after the Ebola River in Congo. But when it came to coronavirus, the United Nations said, no, don't name it China virus. Only Mr. Trump, then President Trump, was naming it China virus. But now we have the South African variant. Now they are naming it using as a country name. I mean, what is this? What's going on here?
Yeah, Chris, that's part of the tragedy when it comes to messaging regarding COVID-19. Obviously, we had somebody here in America who had a bully pulpit, a megaphone. I have called it that. And unfortunately, we have seen a lot of conspiracy theories coming from the highest office in the land in the last year and before that, before COVID-19. So what that has done is something that should otherwise be benign, is now being looked at as because what we should have been thinking about is, okay, it originated from China, the Yuan province, and so forth. How can we help the Chinese people to make sure we contain it there? If I was in Mr. Trump's shoes, that's what I would be talking about. However, it seemed that we were talking more in terms of blaming the Chinese, to say the Chinese brought this virus on everybody else. So there's a distinction between the geographical origin and the aspect about what it means that it came from South Africa or it came from Brazil or the United Kingdom. That's part of the reason why today we have a lot of mistrust with in terms of the origins of the virus, in terms of vaccination, just because the political leaders did a very, very clumsy job at the beginning. And right now, when you say the South African variant, to me, I don't see it as a medical professional in lenses of, oh my goodness. I just see it in terms of, okay, that's how we're identifying it, but that doesn't take anything away from the South African people or the Brazilian or the United Kingdom. So unfortunately, the messaging has been terrible when it comes to COVID-19. And I hope that going forward, we do a better job of that.
Thank you so much, Dr. Ranga. Maybe we can let you go now. And,
thank you.
Yes, thank you so much. But Mr. Balule, you can take over from there.
You.
Mr. Balule, you know why I raised that question? I've seen on the social media many people arguing over that. Some are even saying that, long back there was the Spanish flu and all that, but people never fought against it. And some are saying, by saying the South African variant, you are stigmatizing the South African people. That will be a permanent stigma on them. What's your take on this? Because there is a professor here, Professor Salim Karim, who was on CNN, and he told them to stop calling it the South African variant and call it by the scientific name, because we can't even be sure if it originated in South Africa. Mr. Balule.
Yes, I think there is a case here about understanding the terminologies and the use of these sort of names, calling it South African variant, UK variant, and all that, and all sort of names. But I think basically it may be that although there is a scientific name for this variant, it's easier maybe for many people to call it a South African variant, but there is a scientific medical name for it. But maybe for many people it wouldn't be that easy to say that scientific name. But obviously there is always politics, and there is politics in health services, health delivery, and geopolitics, and all sorts of things like that. And as we know that, you know, some of us from Africa, they will call us, we are from the third world. And there is always that kind of, you know, viewpoint that, you know, we are the most diseased, and all that sort of stuff. But when it comes to the virus, though, it's in different regions. It's in Europe, and they call it UK variant, and then Brazil, they call it Brazilian variant, and then we have the South African variant. And I'm wondering why we didn't actually very much so call it Chinese virus, if we were indeed calling this, you know, the COVID by where it originated. Therefore, we should maybe go back and say, oh, Chinese virus, because you know, that's where it originated. But obviously, there's politics to all this. Yeah.
Thank you so much, Mr. Balule. Chris, we are now joined by Dr. Matthew Nyashano, who is in the United Kingdom. He's a medical expert at Nottingham Trent University. Welcome to our show, Dr. Nyashano.
Thank you for having me.
I know Chris is waiting for you here with a question.
Nyashano, how are you?
Chris, how are you, Mr. Gandhi? Dr. Gandhi, how are you?
Yeah, you came while we were talking about the variants and the names of these variants, and the question that you know, started it all is that why now are we calling these variants by name? South African variant, we have the UK variant, when in the first place we didn't name the original virus, the Chinese virus. What's your take on that?
Yeah, definitely. I think in public health, we have gone over the metamorphosis of language, where language has changed, and we have actually been using certain terms, and that was out of ignorance. If we look, Donald Trump, the former president of the United States, was actually criticized for calling it a Chinese flu because it was disrespectful in terms of how you make reference to a disease. There are so many words that were being used in public health that has been seen to be retrogressive in as far as the relations of people is concerned. We can talk about third world. Those words used to exist, but there are now other progressive words that can actually replace that. So what then comes with such naming of diseases or flus is stigmatization, which is one of the very dangerous things that we want to inculcate in a community. And we have seen that with stigma, many people do suffer depression and mental health, which is not physically, and that can also lead to discrimination because people from South Africa are thought to be carrying this virus. And where do you come from? Oh, you must have a South African variant. So such languages should be avoided to make sure that communities are living in cohesion, communities respect each other, and such languages are a replica of apartheid and the colonial state times, which we should actually take out of it. And in public health, we always talk about social justice, respect for communities, and transparency. In doing all these things, there is need for us to use a respectful language, which is built around a philosophy of Ubuntu. I am because we are.
Yes, Dr. Nyashanu, let me get back to you again. When we look at this coronavirus, like the terminology that you are talking about and so forth, when we go back in history and look at, for example, Ebola, we see that immediately after naming it Ebola from the Ebola River in Congo, then there was talk about how the Ebola had started and ways to stop it. Now we hear that the coronavirus started in China because people were eating bats, snakes, and stuff like that. But after all these people who have been killed and some, by coronavirus, we are not looking at how it started. And no one is talking about stopping people, Chinese people, from eating those bats. What if they continue, they're eating even worse things and there's an even worse virus that will come? Why don't we talk about the genesis of it at all? If we're not going to talk about the naming, like you are saying, let's talk about the history, but it's not being done. Why is it?
I think I can draw you back to say that there are some scientists now who are working with the World Health Organization who are trying to ascertain the origin of the of COVID-19. Again, that's a very difficult scientific process to engage in, which will need high tech. You remember, we still grapple with how HIV started, and it has got so many theories that have been flighted there. And some of these theories that have been flighted has actually damaged communities because of how other people have actually tried to explain it. Some people leave science and start to use their own political backlash against certain communities because they think they are inferior or they think they are causing diseases. And I think what is more important for us at this point in time is to see how we can defeat COVID-19. More importantly, the origin is required. And as I understand, there are some people who are actually trying to work around that. But what we have seen with origin of diseases, where there is no immediate evidence, we have seen that no one has ever come with concrete, scientific, and proven evidence to say this is where the disease emanated from. More importantly, there is need to conjure a big public relations, a united world where we are fighting against such a very dangerous disease like COVID-19, because this disease does not only come with death, that death has got other psychological impact on communities, on families, on young children, on vulnerable people. And this is what we should be grappling with more than coming up with something that can create division amongst ourselves.
But there's no division if we are going to look at the fact that it started. I think scientists are agreed on how it started.
Yes.
And if we are going to agree on how it started, then we should agree on how to stop it. And to stop it is to stop these people from eating snakes and pets. But we'd never hear about such talk that they should be. Right now, I think if it was in Africa like they did when it was Ebola, you'd be having all those messages being sent. People, don't do this, don't do that, do this, do that. But in China, they keep eating those things. And
right, Dr. Gandhi, we do not have evidence to say that eating bats is what caused it. Bats have been eaten since time immemorial. Why didn't we have it? This is why we need scientific.
Recently, I saw a video of our own men in Chipinge there displaying those bullfrogs, saying they've been eating them for time immemorial in Chipinge.
Exactly. And then some other things, yes, there could be some other things that has exacerbated the emergence of this pandemic. But what we need not to do is to quickly jump on cultural practices of certain people because we think this is what is causing the problem. And this is what normally happens, where people think that or you do this which they don't do, and they see it as superior to their own culture, and that causes division amongst ourselves.
Thank you so much, Dr. Nyashano. Mr. Balule, the talk now, I think we are having a bad connection there. He has just dropped. Okay, I can direct this question to Dr. Nyashano. Dr. Nyashano, we spoke earlier about people getting vaccinated, getting the vaccines. And some people say, oh, I got my vaccine yesterday. Oh, this is something that is good. People go out and get it. And some people are saying, no, people should not tell others to go out and get the vaccine. How best can the message be directed to Zimbabweans or to people out there?
Right. This is one of the very most difficult thing to do, and it's historical that whenever there is any new vaccine, there are grapevines that comes out of communities, sometimes stronger than what is preached by professionals. And this emanates from relations of people, it emanates from previous practices, and it emanates from suspicions that are between communities. One of the most important aspects that needs to be done is to have what we call local health promotion education that utilizes influential people from specific communities. What we don't need to have is where certain people come from other areas of the world and try to tell people without educating them that we need to vaccinate you so that you are prevented against this ailment. That can be accepted by certain people who have got a certain level of education, which is not uniform within a community. So what we need is to conjure a health promotion education that is actually done by local people, respectable people, use of people like community leaders, faith leaders, influential people, educated people of those communities to try and convince the people. This is what is needed. There is nothing dangerous in public health than just bringing a vaccine and say to people, line up, and then we'll give you this vaccine. The grapevine from communities, from people who might not be informed, will be stronger than those that will be coming from educated people.
Thank you so much, Dr. Nyashano. Rambai muri parunare tione kuti vaBalule ndikuona vari kumboti vakadzoka vombotiza asi izvozvo ndofunga tavabata. Chris, vaBalule vadzoka.
Yes, Mr. Balule, so when you look at the community, especially the Zimbabwean community in the United Kingdom, is there any kind of trend that you can see that there are some people who are not going to take the vaccine because of certain reasons, or it's just random?
I think there's a lot of talk in social media. There's a lot of theories, conspiracy theories, and there's quite a lot of unscientific remedies that people are fighting about. But I can only talk about the larger part of the community of Zimbabweans that I know. I've not done any credible research, but from many people that I know, they understand very well that this disease is a very dangerous disease, and they have, if possible, take precautions to prevent it. And many people that I know happy, and they will take the vaccines. We have a large number of Zimbabweans working in the healthcare sector in the UK, and those are classed as one of the vulnerable groups by virtue of their place of work, by virtue of their profession. So many of them are really concerned and worried, and they have actually made decisions, most of them, and most of them have already taken the first doses anyway. So yes, many people would consider taking the vaccine because they recognize the facts and they recognize the science. Although there is general skepticism about the vaccine, but largely many people do accept that it is a vaccine that will help control the disease and that will help prevent the disease.
Thank you so much, Mr. Balule. Chris, ndiwonogara uchaura kuti game redu iri harina extra time. Ndapinda mu 60 minutes. Atinongopa Dr. Nyashano mazwi awe kupesera 30 seconds, Dr. Nyashano.
Yes. So probably what I think we need to do with COVID-19 pandemic in terms of the vaccine, we need to make sure that we have local health promotion strategies to convince local people and make sure that they accept the vaccine. Let's be concerned about the small number of people that are not receiving the, who are refusing to receive the vaccine more than the majority who want to receive the vaccine. And that is our point of contention.
Thank you so much. Tasvika kumagumo Chris za 61 minutes. Saka tineta kutozoona kuti ndiani anotakura imwe minute kuti chikamu chedu chinge chichipera. Tinotenda zvikuru vadare vatanga tiinawo nhasi Dr. Matthew Nyashano vari kuUnited Kingdom, Dr. Simbisoranga vari kuNorth Carolina muno muAmerica, Mr. Balule vari kuUnited Kingdom. Ini ndini Jonga Kandemiri ndichiti musata zvakanaka vateereri.
Yes, and I'm Chris Gande. Let's meet again next time. Good night, Zimbabwe.
Thank you.
Yeah.
Bye-bye.